All right, good afternoon, everyone. Thank you for joining this week's specialized talk. It's about kidney disease and the role of the caregiver. My name is Vincent Amazona. I'm the nurse trainer slash specialized trainer for Care Indeed. And again, thank you so much for joining. So let's go ahead and get right into it. A little bit about me. My name is Vincent. I'm an LVN working specifically with senior care clients for the last 4 years. I've worked in subacute, home health, hospice settings, in addition to memory care specific communities. Specifically, memory care is one of my favorite things to work, especially in this industry. I'm of the belief that quality care is the key to overcoming the pains and adversities to our transition clients, what they face as they work to come back home, where we pair them with, where they become clients and they get paired with our caregivers. So today we're going to be talking about kidney and renal disease. My learner goals for you guys are to understand the role of the caregivers for clients as they live with illnesses related to their kidneys and renal system, to identify the specialized needs of the client or loved one living with kidney disease, to gain a better understanding of the renal system. I will be going over the anatomy of it and its functions, and finally, to provide the learner with interventions to provide quality comfort care. So we're going to tackle basically what the system looks like, how it works, how disease affects it, and then some of the interventions that you can do within your scope of practice. So kidney disease can develop at any time, but those over the age of 60 are more likely than not to develop kidney disease. As people age, so do their kidneys. That goes for a lot of our senior clients. A lot of the afflictions that affect them are aging diseases. So a lot of organ failures, systemic failures are the afflictions or illnesses that affect them as they come into the fold with us. According to recent estimates from researchers at Johns Hopkins, more than 50% of seniors over the age of 75 are believed to have kidney disease. Kidney disease has also been found to be more prevalent in those over the age of 60 when compared to the rest of the general population. Now that stat comes from 2018. And certain things are to be considered when you're looking at the next generation or the next wave of seniors coming in. This generation that's coming in now, that's aging into the senior community, they were more raised on sodas. They were more raised on household drinking. The statistics on what type of, how much water would be appropriate, those weren't always universal. They weren't universally shared. They didn't become a certain way of life. Plus the types of foods. We find that people are coming in now with higher salt diets, higher sodium diets, more fast foods. So those numbers will rise. But you'll see, I think, for our younger audience, people in their early 20s, you'll see that there's less, and there's less purchasing of soda and drinking of soda, and a lot more emphasis on drinking water, hydration, and maintaining healthy diets. So it's generational, the trends that we're seeing with regards to kidney disease. But also with the right education, people who are aging into the senior group will be able to help slow down or even prevent certain types of kidney diseases. Kidney disease facts. So kidney disease kills more people each year than breast or prostate cancer. The National Kidney Foundation recommends annual kidney disease screening for anyone over the age of 60. Risk factors for kidney disease include high blood pressure, diabetes, kidney stones, a family history of kidney failure, prolonged use of over-the-counter pain medications, and simply being over the age of 60. Again, those are all systemic issues that are environmental issues that kind of pop up as you grow up. But then simply sometimes organ failure just takes over. For our audience, more than 37 million Americans, that's 1 in 7 adults, have chronic kidney disease, and most of them do not know it. By most, we're talking almost over 60% of the people don't know that they have chronic kidney disease. A lot of kidney diseases you'll find in the early stages aren't detected, aren't treated, and usually most of the time when people find out about their CKD or renal failure, it's already too late. Of over the 120,000 Americans on the National Organ Transplant waitlist, more than 98,000 await a life-saving kidney. It is a very long list. And that hurdle, simply getting on the list, qualifying it, staying for it, getting an organ donor, and then after that, you also have the idea of whether or not your kidney will be rejected, despite multiple efforts to match the organ properly. And for you, our caregivers out there listening or watching, you are vital for any sort of systemic or organ failure. There are going to be considerations or conceits in that person's activities of daily living. To have someone there with the foresight, the dexterity, even just the obvious level of care in their personality is vital. These are all changes that are very serious when it comes to their conditions. Some of them may have new diagnoses and don't know how to roll that into their activities of daily living. So having a seasoned caregiver, a knowledgeable and a confident caregiver is very important. And so we're getting into the renal system now. What you're seeing in front of you is the standard anatomy of a kidney. So over here on the far right, you'll see the renal artery. That is the blood supply for the kidney. So what it does, the kidney filters blood and fluids for toxins and processes them out into the ureter. So over here, you'll see the renal artery feeding the blood. Through here are nephrons, little parts of the filtration system of the kidney, and they exit through the renal pelvis, and all the waste goes out to the ureter, which goes to the bladder, which goes to the urethra, and that's how you excrete it. And then the purified blood goes out through the renal vein. Here's a more macro look at it. You have two kidneys. They're positioned towards the rear of your peritoneum, your torso. They sit right above your hip bones. That's part of the reason why those hip bones stick upward, is to protect them. People who get a lot of damage to that, or if they have a fall and they end up damaging their kidney, kidneys can be bruised, they can be injured. And sometimes if they get lacerated, that means the toxic fluids or the toxins that are trying to be filtered out end up filling up in that portion of the torso. So they work in tandem. You'll see one is filtering in, filtering out, and they both use the ureter to go down to the bladder and excrete toxins through the urethra. One thing we'll talk about today is also kidney stones. So while I have you right here, kidney stones do formulate here inside each of the kidneys. So they either get jammed up here inside the kidney itself and can't be, are too big to leave the renal pelvis, or when they're being passed, and we'll take a look at a couple shapes of kidney stones. You'll understand why it's so painful. They go through the ureter. They may end up getting jammed up in the bladder. And one of the most painful things is trying to pass a stone through the urethra. Primary kidney functions: it helps remove waste and excess fluid. It filters the blood, keeping some compounds while removing others. It controls the production of red blood cells. It makes vitamins that control growth. It releases hormones that help regulate blood pressure. It helps regulate blood pressure, red blood cells, and the amount of certain nutrients in the body, such as calcium and potassium. So it's a pretty one-dimensional, but very fascinating organ in that, much like anything else, it's built off of a pressure system. So you'll see that a lot of kidney failure, kidney disease, is associated with cardiac disease or high blood pressure, hypertension, simply because there's a static amount of volume inside your body in terms of fluids and blood. When that backs up, or any part of those organs or those organ systems back up, that's when there's an exertion on the walls of the arteries and the veins, causing high blood pressure. So you can imagine that this, if it's streamlined, the renal vein or in the renal arteries, if they're streamlined, they're running perfectly. Blood flows in, there's no issue. Blood flow, toxins go out, filtered blood goes back to the rest to the heart. If there's anything that helps to jam that up, cholesterol, or like we said, stones, or an improperly working filter, then all of that fluid ends up getting jammed up. It stretches out the hoses of your arteries and your veins, basically the walls, and the main pump, which is the heart, ends up taxing itself in order to compensate for the backup of blood. So just a rundown step by step. Blood enters the kidneys through an artery from the heart. Blood is cleaned by passing through millions of tiny blood filters. Waste material passes through the ureter and stored in the bladder here as urine. Newly cleaned blood returns to the bloodstream by way of veins, and the bladder becomes full and urine passes out of the body through the urethra. This process, when it comes to filling the bladder, takes anywhere, again, depending on the size of your bladder, can take anywhere from 1 to 8 hours. So we're talking about kidney function when it comes to disease, the ability of the organ itself to properly do its job. The stages of chronic kidney disease, which is kidney disease that doesn't have a sudden onset and is a current livable condition for a lot of our clients, is marked by stages depending on the percent of kidney function. Stage 1, or early CKD, the kidney function is lessened anywhere from 10%, where the kidney is still damaged with normal kidney function. Stage 2, mild loss of kidney function, that's 89 to 60%. Stage 3A, because stage 3 is split into 2 for multiple reasons, but mild to moderate loss of kidney function is 59 to 45%. Moderate to severe loss of kidney function is 44 to 30. Severe loss of kidney function is 29 to 15%. And end stage kidney failure is when the kidney function works at less than 15%. And you'll see a column here in the middle called GFR. Your GFR number tells you how much kidney function you actually have. As kidney disease gets worse, the GFR number goes down. So GFR stands for glomerular filtration rate, which is the best test to measure your level of kidney function and determine your stage of kidney disease. Now, this is ordered by the doctor, performed usually in a general setting, but can also be done and monitored by a nephrologist, where they calculate it from the results of your blood creatinine test based off of your age, race, gender, and other factors. The earlier kidney disease is detected, the better the chance of slowing or stopping its progression. Any questions so far? Okay, so what we're looking at here are kidney stones. Kidney stones come in different shapes and sizes depending on the type of toxin that it's formed from. So over here on the top right, that's a kidney stone that's based off of uric acid. So that's the same type of crystal that you'll find in someone who has gout in their joints or their big toe. This one over here on the left, this is actually an image from, I want to say, the BBC, where I think the record surgery for removing kidney stones stands at, I think, 240 or 420 in one person. And then down below, we have a diagram of how, again, those stones are passed, but also get jammed up inside the kidney. You'll see here in the medulla, it gets plugged up. And then over here, you're seeing it being jammed up in the ureter, where it will get stuck. These shapes are not modified. So there you can see some of them are of varying sizes depending on the flow If you were to imagine like a snowball effect, if someone is rolling a small snowball down a hill and the snow is sticky enough, it ends up clinging to it and it grows and grows and grows. There is a turbulent effect throughout the kidney that does the same to these shapes. It's also the type of flow you would imagine with rocks in a river versus rocks in the desert. Some are sharp, some of them are smoothed out by the flow around it. As you can imagine, crystallized ones like the top right are much more painful simply because they're more jagged, they have points, and that's just due to their molecular structure. But when they pass, they do have the displeasure of tearing at the tissue around it, or they end up getting lodged much more easily. So a kidney stone is a hard object that is made from chemicals in the urine. There are 4 types of kidney stones: calcium oxalate, uric acid, struvite, and cysteine. A kidney stone may be treated with shockwave lithotripsy, uteroscopy, percutaneous nephrolithotomy, or nephrolithotripsy. So you can use, it's just ways of breaking up the stone. Percutaneous nephrolithotomy is the most surgical version, where they actually end up cutting into your abdominal cavity through the back and then removing them. So that would be how they removed these stones here. These smaller brittle ones, like the uric acid ones, they'll try to give you as much medication as possible to pass it without having to go to surgical means. Otherwise, they might use light wave therapy or shockwave therapy. So common symptoms include severe pain in the lower back, blood in your urine that goes back again to the tissue walls being torn at, nausea, vomiting, fever, and chills. Those are all signs of infection, or urine that smells bad or looks cloudy. For our caregivers, you may have some clients that have catheters. And now, catheter is an invasive tool in order to evacuate directly from the bladder. So if you have urine that smells bad or looks cloudy, that's again a sign of infection. That's one of the huge observations that a caregiver can provide with people who have urinary tract infections, working with people who have renal failure and kidney diseases, is monitoring the output of the urine, monitoring and observing the color, the frequency, and even the smell. Urine has various wastes dissolved in it. When there's too much waste and too little liquid, that's where the crystals begin to form. The crystals attract other elements and join together to form a solid that will get larger unless it is passed out of the body with the urine. Usually these chemicals are eliminated in the urine by the body's master chemist, the kidney. So the major common types of kidney disease are acute, chronic, and renal failure. Acute kidney failure occurs when blood flow to the kidney is suddenly decreased. Causes of acute kidney failure include injury, bleeding, a heart attack, heart failure, infection, or severe allergic reactions. Acute kidney failure can sometimes be reversed. However, if it's not treated, it can lead to chronic kidney failure. Now again, acute has sudden onset, something like an injury or a heart attack. Those are changes of condition that happen suddenly without warning. So hence the term acute. But again, if not treated, if not addressed, then it can lead to chronic, because that means permanent damage. So chronic kidney failure is progressive and irreversible damage to the kidneys. Over time, the nephrons are destroyed and symptoms appear when 75% of the kidney function is lost. Common causes of chronic kidney failure are high blood pressure and diabetes. The result is usually end-stage renal disease or renal failure. We were talking about high blood pressure earlier, but also diabetes is a huge one. It alters the blood chemistry, and if the filtration process of the kidney is affected or taxed over the long term, that's when it ceases to function properly. Imagine like a pool filter with just really dirty water or constantly getting clogged up like a vacuum filter. And pretty soon the vacuum can't handle that much, and then it fails. Much like what would happen with a kidney. Now, renal failure is the inability of the kidneys to maintain fluid and electrolyte balance and excrete waste. Fluid restriction, drugs, diet, and dialysis are the typical treatments for renal failure. Now, we're also going to talk about dialysis, but while those are 3 stages of the kidney disease, there are causes. Like we talked about earlier, 2 main causes of kidney disease are diabetes and high blood pressure, which are responsible for up to 2/3 of the cases. Glomerulonephritis is a group of diseases that cause inflammation and damage to the kidney's filtering units. These disorders are the 3rd most common type of kidney disease. There's also inherited diseases, such as polycystic kidney disease, which causes large cysts to form in the kidneys and damage the surrounding tissue. There are also birth defects, malformations that occur as a baby develops in its mother's womb. For example, a narrowing can occur that prevents normal outflow of urine and causes urine to flow back up to the kidney. Those are usually addressed in newborns. They usually have corrective surgery earlier on rather than later. There are autoimmune diseases like lupus that affect the body's immune system. Obstructions caused by problems like kidney stones, tumors, or an enlarged prostate gland in men, or a history of repeated urinary infections. What causes increased risk for kidney disease? Like we talked about earlier, if you have a history of diabetes, history of high blood pressure, have a family history of kidney failure, going back to the beginning, are just in a general older population, or you belong to a population group that has a high rate of diabetes or high blood pressure, such as African Americans, Hispanic Americans, Asian and Pacific Islanders, and American Indians. Is kidney failure permanent? So some kinds of acute kidney failure get better after treatment. In some cases of acute kidney failure, dialysis may only be needed for a short time until the kidneys get better. Again, that's due to injury or sudden change of a condition. Usually if someone has a heart attack or they were injured like in a car accident, they're going to go to the hospital immediately, so it can be addressed sooner than later. In chronic or end-stage kidney failure, your kidneys do not get better and you will need dialysis for the rest of your life. If your doctor says you're a candidate, you may choose to be placed on a waiting list for a new kidney. So what are some of those treatments? A kidney transplant. When you get a kidney transplant, a healthy kidney is placed inside your body to do the work your own kidneys can no longer do. On the plus side, there are fewer limits on what you can eat and drink, but you should follow a heart-healthy diet, which we'll talk about a little bit later. Your health and energy should improve. In fact, a successful kidney transplant may allow you to live the kind of life you were living before you got kidney disease. Studies show that people with kidney transplants live longer than those who remain on dialysis. But on the minus side, there are the risks of surgery. You will need to take anti-rejection medications for as long as your new kidney is working, which can have side effects. You will have a higher risk for infections and certain types of cancer. And although most transplants are successful and last for many years, how long they last can vary from one person to the next. Many people will need more than one kidney transplant during a lifetime. One fun fact about kidney transplants is if you are a kidney transplant recipient, they don't remove the non-functioning kidney. So you end up with 3 kidneys. I thought that was pretty interesting, but it really does make sense. And then the huge treatment that we talked about earlier was dialysis. Dialysis is a treatment that does some of the things done by healthy kidneys. It is needed when your own kidneys can no longer take care of your body's needs. When your kidneys fail, dialysis keeps your body in balance by removing waste, salt, and extra water to prevent them from building up in the body, keeping a safe level of certain chemicals in your blood, such as potassium, sodium, and bicarbonate, and helping to control your blood pressure. Has anyone experienced or had someone they've lived with go through dialysis?
Yes, I have.
Yeah. Yeah, so you can understand it's a very intensive process. There are a couple ways to go about dialysis. Do you know what type of dialysis that person was going through?
Uh, from what I recall, uh, no, I just remember hemodialysis. So my mother used to go have her dialysis sessions like the doctor actually recommended 3 times a week,
Hmm.
but she begged off to have it just once to twice a week at that
Okay.
time.
Hmm. So yeah, hemodialysis. If you guys are looking at and thank you for sharing that. Hemodialysis. If you take a look at the chart that's on your screen, you're hooked up to a machine, and blood filtered and cleaned through the dialyzer. And the dialysis machine is basically a large pump. During hemodialysis, blood passes from your body through a filter in the dialysis machine to remove waste and extra fluid from your blood. A vascular access is needed to create the entrance into the blood vessels to allow the blood to be removed and returned. That's called a port. That is it's an opening that's going to be left into one of your major arteries. So that way, the largest arteries can be hooked up to the dialysis machine. Um, like was stated earlier, this is performed in a dialysis center 3 days a week for a few hours a day. There are some factors that weigh into that based off of the size of the person, how far along they are in their kidney disease, and if they're on any other medications. Another form is peritoneal dialysis. So this one can be done without an actual pump. During peritoneal dialysis, a cleansing fluid flows through a tube. So there's a solution here, and then there's a three-way catheter, and it goes straight into your peritoneum. So into part of your abdomen. The lining of your abdomen then acts as a filter and removes products from your blood. After a set period of time, the fluid with the filtered waste products flows out of your abdomen and is discarded. These treatments can be done at home, at work, or while traveling. Yep. So, yeah, watching after someone with peritoneal or that's on dialysis experiencing changes of condition when it comes to kidney disease, there are a couple things that within our scope of practice as caregivers, you would be able to help your client with or a loved one. One of them is definitely monitoring for pain. And what is pain? Pain is physical suffering or discomfort caused by illness or injury. It's universal and it is subjective. So, what's painful for you may not always be considered painful for another person. That's the subjective part. As a caregiver or in any person in the role of care, you have to give credence to that person's level of pain. If they say it's a 10, then yes, to them it's a 10. One of the things that kind of irks me with caregivers and sometimes nurses is when they call other people out on their level of pain or try to hush them when they're asking for medication based off of pain. And I understand that there's a level of um, disbelief with some people who are in the role of care as to whether or not someone's experiencing pain. But if we were to pay attention and if we were to just listen to the person's cries of pain or complaints, we definitely have to give into reason and identify that that person may be in pain. So yeah, pain is subjective. For those of you who have loved ones or clients that are nonverbal, you have to pay attention to nonverbal signs of pain. That includes facial grimacing or a frown, writhing or constant shifting in bed, moaning, groaning, or whimpering, restlessness and agitation, appearing uneasy and tense, perhaps drawing their legs up or kicking, guarding the area of pain or withdrawing from touch to that area, especially clients who have ports or if they're suffering from trying to any post-op from having a stone or having passed a stone. We have to pay attention to those signs of pain so that we can make sure that they're comfortable on a day-to-day basis. Another way you can bring it up is using the Wong-Baker faces. By far my most favorite practical application in all of healthcare. It's a pain measurement scale. All you have to do is show the person the faces, and they're usually triggered to be able to point to the face that most applies to their feelings. On a verbalized pain scale, when people say on a scale of 1 to 10, how with 1 being the least amount of pain, 10 being the most amount of pain you've ever felt, where is your pain currently? When they give a 1 to 3, you can equate that with mild pain, 4 to 6, moderate pain, and 7 to 10, severe pain. When it comes to interventions, caregivers should only administer non-drug therapies that are within their particular scope of practice. Make sure you follow the policies and procedures of your setting, your home care agency, your facility, anything in that regard regarding administration of non-drug therapies. So for our kidneys, some of the things that we can do is making sure we're staying hydrated, drinking lots of fresh water, quit or stop smoking, doing exercise daily, and eating healthy food. So a lot of this has to do with the idea of flushing your system. Staying hydrated and drinking lots of fresh water ensures that that you're washing your body of toxins, helping your kidneys to be able to filter out blood. Quitting or stopping smoking means getting rid of, again, toxins or waste in your blood. Doing exercise daily means getting that necessary circulation that helps channel and move fresh blood, get your heart pumping on a regular basis to be able to function properly. And then eating healthy food, that's limiting the chances of eating in a diet that's high in any sort of chemical, like sodium, that would affect your whole body system. One of the most important diets that you'll see some of the people with renal failure or kidney disease is the DASH diet. Now, growing up, I thought when I heard the word DASH diet, it meant dumping a lot of Mrs. Dash on your food, but apparently that's not right. So I just had to bring up that picture. But the DASH stands for Dietary Approaches to Stop Hypertension. Again, we're relating kidney disease to high blood pressure. But the DASH diet is rich in fruits, vegetables, low-fat dairy products, whole grains, fish, poultry, beans, seeds, and nuts. It is low in salt and sodium. It's low in added sugars and sweets, fat, and red meat. The DASH diet is a recognized treatment for hypertension, heart disease, and kidney disease. You can go to kidney.org. If you want to know more about the DASH diet, they actually give sample 3-day diet or meal plans for you to take a look at. And in some cases, I think there's even a shopping list that you can take a look at if you want to try out the DASH diet. By far, one of the most interesting things when you're talking about the information age and the access to the internet is trying out meal plans. See what works for you and being able to modify them. It's not really about being stuck with whatever's around you anymore, simply because you have that information available to you. And definitely, as a caregiver or someone who's in the role of care for a loved one, it's something to try along with the person. You know, if they're currently experiencing hypertension or kidney disease, there's nothing to say that you can't try something like this alongside with them. That way they don't feel isolated, they don't feel alone, and they'll be more receptive to care. And fluid intake. Fluid intake is one of the biggest issues. We talked about hydration, making sure you're getting plenty of fresh water. But there are some myths about it. And there are some concerns that you should take if you're in the role of care when someone's limited to fluid intake. So about 60 to 70% of your body weight is made up of water, and every part of your body needs it to function properly. Water helps the kidneys remove waste from your blood in the form of urine. Water also helps keep your blood vessels open so that blood can travel freely to your kidneys and deliver essential nutrients to them. One of the things when it comes to water and blood is pretty interesting to me is when someone shows up with a low blood pressure, one of the first things that we try to tell them to do is have the person drink a glass of water just to see if it'll affect the blood pressure going up. Sometimes that's a sign of dehydration because the vasculature or the veins in your body end up getting a little bit flat when you have low blood pressure. It's a vascular constriction. So yeah, when we get caregivers calling in about someone showing up with or presenting with a low blood pressure, we tell them to try postural repositioning, and we also tell them to take in some fluids as well to see if that helps get them up. If you become dehydrated, then it's more difficult for this delivery system to work. Mild dehydration can make you feel tired and can impair normal bodily functions. Severe dehydration can lead to kidney damage. So it is important to drink enough when you work or exercise very hard, and especially in warm and humid weather. There really isn't a reason to be drinking Gatorade. One of those things is you'll see a lot of people downing Gatorade after work. There's a lot of salt and sodium in those things, as well as sugar. So stick with water by all means, or cut the Gatorade with water if you have to. Again, if you have kidney disease, you should refer to your doctor about what you should be taking afterwards. So there are about 6 general rules for fluid intake. I put 3 here, and then I'll go into the other 3 major ones. 8 is great, but it's not set in stone. So there is no hard and fast rule that everyone needs 8 glasses of water a day. This is just a general recommendation based on the fact that we continually lose water from our bodies and that we need adequate water intake to survive and optimal amounts to thrive. The Institute of Medicine has estimated that men need approximately 13 cups or 3 liters of fluid daily, and that women need approximately 9 cups or 2.2 liters of fluid daily. Now that goes up or down depending on a couple things, level of exertion or activity being one of them. If you're in a warmer or humid climate where you sweat more, that's also taken into consideration. Another one is the amount of food that you have that's more water dense. Salads, celeries, watermelon. Those are all things that do have water in it as well. So again, no hard and fast rule, but usually stick to that 3 liter or 2.2 liter of fluid daily. And you should see some improvements in terms of your hydration status. Less is more if you have kidney failure, also known as end-stage kidney disease. When the kidneys fail, people don't excrete enough water, if any at all. Remember going back to that diagram of the anatomy of the renal system. If the filter is broken, that doesn't mean that everything's passing through with toxins. That just means, it could also mean that not any fluid's making its way out, especially if you have something like kidney stones or any sort of constricture. So for those who are receiving dialysis treatment, water must actually be greatly restricted. Again, remember, they're getting water removed from them, but they're also getting fluids or solutions placed into them as well. So that needs to be taken into consideration when you're talking about total volume of fluids inside the person's body. And again, it's possible to drink too much water. Though it's not very common for this to happen in the average person, endurance athletes like marathoners may drink large amounts of water and thereby dilute the sodium level in their blood, resulting in a dangerous condition called hyponatremia. And here we get into the more important parts of fluid intake. Urine can reveal a lot. So for the average person, being water-wise means drinking enough water or other healthy fluids, such as unsweetened juice or low-fat milk, to quench thirst and to keep your urine light color or colorless. When your urine is dark yellow, this indicates that you are dehydrated, and you should be making about 1.5 liters of urine daily, so about 6 cups. Usually the standard that they tell us in nursing school is you want like straw colored or hay colored urine. So like that light, I don't know, yellowish, brownish or goldish color. And also as a caregiver, when you're monitoring someone who has kidney disease, even if it's something that they're just voiding into the toilet, you have to monitor the amount keep an eye towards the amount, be mindful of it, be mindful of how frequently they're urinating. And also, again, the appearance of it. Is it cloudy? Are there drops of blood in it? Is there a smell to it? Those are all signs of infection, so those need to be addressed. If they've had any post-op surgeries and blood is showing up in the urine, that needs to be addressed as well, because that could be a sign of internal bleeding. H2O helps prevent kidney stones and UTIs. Kidney stones and urinary tract infections are two common medical conditions that can hurt the kidneys and for which good hydration is essential. Kidney stones form less easily when there is sufficient water available to prevent stone-forming crystals from sticking together. Water helps dissolve the antibiotics used to treat urinary tract infection, making them more effective. I'll go over that one again. Water helps dissolve the antibiotics used to treat urinary tract infections, making them more effective. It is the main transport system for any supplements and medication that you take. Some of them you should take with food depending on how that delivery system goes with the medication, but water is definitely going to ease things up. Drinking enough water also helps produce more urine, which helps to flush out infection-causing bacteria. So yeah, when I have patients, clients, or residents that have multiple UTIs, we are constantly monitoring the quality of their urine. And one of the best ways to make sure you're always going to get a consistent sample of urine from them is to ply them with water, provided they don't have any fluid restrictions. It's just the best way. If you want to test how something functions, you got to let it function. So making sure that you are pushing fluids to prevent dehydration, to promote good hydration practices, those are very important. Beware of pills and procedures. Drinking extra water with certain medications or before and after procedures with contrast dye may help prevent kidney damage. Read medication labels and ask questions before undergoing medical procedures involving contrast dyes. Those are tests where they're going to make you swallow a jug of dye, so that way they can test certain functions of your vascular system or your renal system. Always consult with the healthcare provider first, though, especially if they are on a fluid restriction. That's for your clients or for your loved ones. While we want to make sure that we're testing for those levels of functionality, we can't, again, just keep giving patient, resident, client, or your loved one a bunch of water without paying attention to their intake practices. In some cases, as a caregiver, you might actually be asked to record the amount of intake. It's tedious, but it's more vital than it actually seems when you're talking about people with end-stage renal failure. Other types of interventions that you can help the person with: exercise, postural repositioning, therapeutic touch, hot and cold therapies. So therapeutic touch goes towards massage applications. Again, do this in line with your facility's practices or any care plans that your agency may have set aside for your client. Massage is provided using mechanical devices or through hands of an individual by using light pressure to rub, stroke, or knead parts of the body. How massage works is it's soothing pain and relaxing tense muscles. It addresses specific locations of pain or relaxing the whole body, and it helps improve circulation. Again, we're trying to help improve circulation, blood flow, as well as fluid excretion. For massage applications, make sure you assess preference for touch before massaging. Again, that may be in the client's care plan. That may be against the rules of your facility. So make sure it's okay to get into these types of things. Massage usually happens for about 5 to 20 minutes using light pressure and steady stroking. If you're going to use lotions or essential oils, if not contraindicated, meaning there's no restriction against it, or they're not allergic to certain types of oils, or it's not allowed if they have a skin condition. But it typically helps to reduce friction against the skin and moisturize the skin simultaneously. Remember, as a client gets older, especially if they're dehydrated, their skin ends up being very fragile. It ends up shearing or tearing if rubbed without proper attention. So you don't want to end up wanting to help somebody with therapeutic touch and then giving them a skin tear. And then massage can also be done at the time of analgesic administration. So it's a bit of a distractor when you're giving pain medications to your loved one or client. And try to schedule the massage at a specific time of day, as this gives the person something to look forward to. You know, it may not be something you do every day, but if you add it to someone's schedule, seniors, and some of our clients will thrive on that level of routine. Giving them an event to look forward to goes a long way towards life enrichment. And here are the do nots for using massage. Don't use massage if it increases the level of pain. Again, follow the nonverbal or even verbal signs of pain. Massage areas being treated with radiation, if they have that, the skin is more, not massage areas being treated with radiation. The skin is more fragile. Don't use lotions or powders on those areas. If being treated for bone metastases, bones are at higher risk for fracture or increasing bone pain. Those are for more likely people with osteopenia, osteoporosis, or going through chemo, which in some cases, men who have had prostate surgery or have prostate cancer will go through sort of radiation therapy. So that's definitely something to be looking out for. Don't massage over open wounds, especially the ports or any surgical wounds that the person may have, because you're increasing the possibility of infection. Remember, that's an open door into the body, so you don't want to mess with that. And you run the risk of interrupting any healing. You also run the risk of damaging the wound dressing, tearing the skin when it comes to staples or stitches. Don't massage lower extremities without checking with a nurse, because a person may be at risk for developing blood clots. If they are suffering from hypertension or congestive heart failure related to chronic kidney disease, their lower extremities become swollen. And if they have that level of edema or swelling, you don't want to be massaging it too much, because again, the fluids, the blood ends up clotting. Because the pump's not working as much or working too hard, that it can't properly circulate the blood that pools according to gravity at the lower extremities. Don't massage areas with blood clots, as these could become emboli. Don't massage areas with pressure ulcers, because massage could cause further damage. If your client with kidney disease is non-mobile or chair-bound or bedridden, you have to check those pressure ulcers. Another thing is if they're diabetic and they're suffering from neuropathy, you have to check their skin constantly to make sure that there's nothing wrong with it. Cold therapy, cold treatments such as frozen gel packs or cold cloths are placed at near the site to relieve pain. Works by numbing nerve endings in the skin, reducing muscle spasms, and decreasing swelling. Cold applications may work better than heat in some situations. And researchers found that cold usually relieves more pain and more quickly than heat. Pain relief from cold lasts longer than pain relief from heat. And cold is more effective in decreasing pain and swelling in the first 72 hours following acute injury. Go team cold. So cold therapy guidelines: don't use it if it increases pain, much like anything else. Provide extra warmth if needed, like a sweater or blanket while cold is in place. Use single layer of cloth between ice pack and skin to prevent skin from freezing. For some, a gradual onset of cold application is preferred. This can be achieved by wrapping the cold pack with many layers of cloth and removing the layers slowly, one at a time, so that the skin gradually becomes accustomed to cold. Another strategy is to begin with a warm, moist cloth between skin and cold pack, and try alternating cold applications with heat, finding the correct area or temperature that provides the most relief. Avoid applying cold packs to areas being treated by radiation, areas with poor circulation, and again, open wounds. Please pay special attention to those clients that have ports. They're very difficult to place. Sometimes they need to have those sites rotated, and there's only so much space that they can actually place those. So if those become compromised, it becomes more difficult for treatment down the line. And you don't have to necessarily limit the use at the site of pain. It can be applied on the opposite of the body where the pain is felt. So a lot of kidney issues you'll find that are going to be radial back pain. So it's back pain that radiates from the side to the back. You can place it on the other side of the body, meaning placing it on the front of the abdomen, or at above or below the site of pain. That helps as well. When using cold therapy, remove the gel pack from freezer and wrap it in a pillowcase or towel. Make sure the bag does not leak. Help older adult into a comfortable position. That's postural repositioning to make sure they're comfortable, and apply gel pack to painful area, securing with elastic wrap if needed. A gel pack may be placed above or below the site of pain, or on the side of the body corresponding to where the pain is located. Above or below the site of pain is helpful when it comes to blood flow. It's one of those things where it triggers the nerves and the blood circulation around it. You should leave it on for a maximum of 15 minutes, 3 to 4 times a day. Again, this is general rule. There will be instructions typically set in the care plan by the health care team members in order to make sure that the cold therapy or any therapy doesn't run too long or isn't too frequent to compromise the person's healing. And make sure you always return the gel pack to freezer for future use. For warm packs, you could use a wet warm cloth, so something that's soaked with warm water, and you just place it on the affected area to ease pain. Be sure to protect any type of heating pad device from coming in direct contact with the skin. Precautions should be taken to avoid burns, especially if you have nerve damage, such as from diabetes or other health problems. People with poor circulation, people with diabetes end up with neuropathy, which means it's, the pain scale is kind of thrown off. They may not feel everything in their extremities. If they are going through heat therapy, they may not be able to tell that something's hot until it's too late for their skin. So one of the things is also like heating blankets. You got to make sure that those are used with a lot of diligence, or try to not use them at all. It's probably best to layer blankets if possible, so that way you can adjust the temperature as needed. And exercise. So we saw that cartoon earlier of the kidney wearing the headband, as cute as that was. Exercise improves strength, flexibility, endurance, and overall physical function, allowing patients or your loved ones to perform tasks and participate in activities with less effort. Again, provided they're in between procedures, not immediately after something like dialysis, it's good to have a routine set of exercises. Again, that promotes blood flow, circulation, and that's exactly what you kind of want, or exactly what you need when it comes to dealing with the renal system and potential high blood pressure, especially diabetes too. Exercise activates inhibitory pathways in the CNS, which inhibit nociceptive activity and provide analgesia. So it's a good distractor from pain. Exercise alters the immune system by reducing the release of inflammatory cytokines and increasing the release of anti-inflammatory cytokines. Exercise can also reduce stress, depression, and anxiety. And postural repositioning. So positioning is assisting the patient to stay in comfortable positions. One of the first things you could do after you measured someone's level of pain is try to readjust their situation. If they're seated improperly, that could be the level of general body pains. So you try to ask or try to move them, again, with communication levels that are proper, and letting them know that you're going to try to move them around a little bit into a better position. So you're trying to take pressure off of their tailbone, where you're trying to spread out their body to make sure it's equal amounts of pressure on all parts of the body. So it helps with pain management. For me, it's one of the first things I usually go to when it comes to complaints of pain. It decreases the risk of complications such as bed sores, helps maintain range of motion, gently bending and straightening arms and legs while helping your patient turn. Don't force the joints or muscles beyond a place of comfort, and always use the patient's reactions as a guide. For positioning and stretching, use pillows to support the client. Make sure that the ear is flat on the pillow and not turned under when patient is on their side. Again, it goes back to skin being fragile. You can actually tear the corner where the ear meets the neck if the ear isn't flat or it gets rubbed the wrong way. A full body pillow can be used to position your patient on their side. If they're able to sit up, suggest to your client or your patient that they pretend to write the alphabet in the air using feet or arms. They can alternate arms or feet, writing 6 letters at a time, A, B, C, D, E, F, and then on the other foot, G, H, I, J, K, L. It just gives them something that's very small, that's also very relatable, depending on the level of cognition, and it's also an activity that you and your client can take part in as well. And for implementation, all of these interventions that we talked about today, it's really down to a safe level of experimentation when you're talking about what works. So consider care planning a trial of assisting your older adult to use a strategy for 3 days. Ask them to rate their pain before and after each successful therapy. And if it is effective in reducing pain, try to implement the process permanently so that all team members can encourage the use of this non-drug technique. Make sure you're documenting your findings and sharing them with the rest of the healthcare team. For people with chronic kidney disease, bringing it back to that. If they have ports, if they have post-op surgeries, if there is a complaint of a urinary tract infection, your observation, your notation, and the dissemination of that information is very key to everybody. Again, I can never stress enough how important caregivers are on the basis of the amount of contact time that they have with a client. Any healthcare team worth their salt would always look to the caregiver for the most up-to-date trends, information, and reports. So that can only be effective if you're documenting it and sharing that information properly. When it comes to this type of system, we're talking about people with renal failure and kidney disease. We want to monitor their level of fluid intake, the frequency, the consistency, the color, the smell, the odor of their urine, the level of exercise that they're going through, their complaints of pains, and checking for their skin as well. So again, those are all very important. And I wanted to thank you today for taking part in this talk. If you guys have any questions, let me know. My name is Vincent Amazona. I'm the specialized trainer at Care Indeed. If you have any questions, reach out to me at training@careindeed.com, or you can give me a call at 650-328-1001, and I'll be happy to answer any questions you may have going on. Thank you.